Pregnancy myths. During your pregnancy you will hear scores of different myths, some about things that can harm your baby, while others claiming to shed light on the gender of your baby. Pregnancy is a crucial period for a woman, that spans over a period of 9 months. Various old wives' tales have been passed on from one generation to another, some of them with absolutely no scientific basis. These myths spearhead unnecessary fear in many women, which is why it is important to find out the truth. Some common myths and their reality are mentioned below. Pregnancy myths. Myth: while giving birth, cutting is better than tearing. Reality: during episiotomy, cutting involves many layers of tissue and muscle. Tears are small, do not extend into the muscle, and heal more comfortably. Myth: during pregnancy, sex can hurt the baby. Reality: in a majority of cases, sex is very enjoyable for the woman, due to the enhanced blood flow to the pelvic floor. However, in some cases sex should be avoided. Myth: for every baby, one tooth is lost. Reality: if women have an intake of 1,500 milligrams of calcium per day, either from food sources or supplements, there is no issue of losing a tooth. Teeth are lost only in case of malnutrition, deficiency of calcium, or close interconceptional periods. Myth: by raising the arms above the head, it is possible to tangle the umbilical cord. Reality: entanglements occur during early gestation due to fetal activity. Some babies are born with the cord surrounding the neck or around the legs or having knots. The mother cannot affect this condition. Myth: if the mother sleeps on her back, the baby will get hurt. Reality: for a normal pregnancy, a woman can take any position that is found comfortable. In case of a high-risk pregnancy and suspicion of severe water retention, hypertension, maternal kidney malfunction, or fetal compromise, resting on the left side is advised. Myth: the baby's gender can be determined by the fetal heartbeat or the way of carrying. Reality: only ultrasound or amniocentesis can be used to find out the baby's gender. There is no other method. Myth: coffee has a detrimental effect on the baby. Reality: coffee, if taken in small amounts, like up to 3 cups per day, is not harmful. However, larger amount of caffeine may result in a baby with low birth weight. Myth: use of cell phones, microwaves, and computers are harmful to the fetus. Reality: using computers and cell phones during pregnancy is totally safe. In case of microwaves, the user may be exposed to radiation, only if there is a leak. However, overuse of cell phones and microwaves should be avoided. Myth: if the baby moves, it is a matter of concern. Reality: when the baby starts moving, the mother must keep count of the baby's movements. If there are maximum 10 movements in 6 hours, there is no reason to worry about. Myth: exercise must be stopped during pregnancy. Reality: exercise is good if it does not make you weary, overheated, or extremely breathless. Generally, there must be sufficient oxygen to chat throughout the workout. Those not accustomed to heavy exercise can start brisk walking. Myth: a pregnant woman must not carry or lift anything at all, for example a 3-year-old child. Reality: if there is no strain in lifting or carrying, it is not harmful. The knees must be bent and the object must be kept close to the body. Myth: flying is not safe during pregnancy. Reality: if the delivery date is more than 6 weeks away, it is quite safe to fly once in a while. Passing through airport security is also safe. The woman must find out the policy of the airline. If the flight is long, the woman must move around periodically and stretch her legs to avoid edema in the legs. If her job needs frequent flying, the schedule must be modified to avoid high doses of radiation in flight. Myth: paracetamol affects the baby. Reality: physicians are of the opinion that an occasional analgesic for aches is not harmful. However, the physician must be consulted regarding the kind of medicines that can be used. Myth: morning sickness results in the baby not getting sufficient nutrition. Reality: morning sickness is not something to be concerned about. If the woman is healthy before getting pregnant, the baby is generally well nourished. Folic acid supplements should be taken. Only dehydration, severe weight loss, or severe morning sickness are conditions to be concerned about. Myth: bumps and falls are harmful to the baby. Reality: the baby is well protected in the uterus. Moreover, the amniotic fluid present in the amniotic sac cushions the fetus from minor bumps, falls, and stumbles. Only if one experiences cramps or vaginal bleeding, the physician must be consulted. HELLP syndrome in pregnancy. The word HELP is an initialism for hemolysis, elevated liver enzymes and low platelet count. HELLP syndrome was first diagnosed by Dr. Louis Weinstein in the year 1982. It is a life-threatening complication in pregnant women, that is considered to be a variation of preeclampsia. This complication generally arises during the later stages of pregnancy, that is, around the third trimester or even immediately after childbirth. Causes: there is no known cause of this life-threatening complication. Some people claim that women who have a family history of HELLP syndrome may be more susceptible to it. Furthermore, women who have had a previous pregnancy wherein they suffered from such a syndrome, may be more likely to suffer from it in their next pregnancy as well. Women who also had preeclampsia during pregnancy also have a tendency to suffer from this complication. Also, women who experience late pregnancies, who are obese, and who also have blood pressure problems, are likely to suffer from this syndrome during pregnancy. In general, most of the effects are due to an aftermath of the activation of the coagulation cascade in the body. Symptoms: often women who suffer from this syndrome have gestational hypertension, that is, high blood pressure. They may also be suspected of developing preeclampsia. Thus, the syndrome has an onset with headaches, malaise, blurry vision, nausea and vomiting, pain around the upper abdomen, excessive weakness, etc. The excessive weakness and pallor is usually due to the hemolytic anemia. There may also be paresthesia and edema present. The hypertension, though diagnostic in nature, may be mild. If the high blood pressure is severe, then it may even lead to rupture of blood vessels, due to which there may be a hematoma. If there is a seizure or if the patient slips into coma, then it means that the condition has progressed to eclampsia. There may even be disseminated intravascular coagulation, and if treatment is not meted out in time, there may also be acute renal failure. Treatment: the treatment for this dreadful syndrome will depend on many factors, like the health of the patient, the trimester of the pregnancy, medical history of the patient, severity of symptoms, etc. In most cases, there is a need for hospitalization so as to keep the patient under observation. Although administration of drugs also help, it is not clear as to what drugs can be given at this stage to reverse the symptoms. Mostly, antihypertensive medication is given to keep the blood pressure under control. It is said that the administration of magnesium sulfate helps to prevent the occurrence of seizures. If the symptoms are severe to the extent that they put the health of the mother and the baby in danger, then the treatment consists of early delivery of the baby. This is a serious complication that is seen in around 0.2 to 0.6% of all pregnancies. Many doctors tend to misdiagnose this condition in its early stages, due to which there may be an increase in the chances of liver or renal failure and thus, the overall morbidity rate. Thus, when it comes to HELLP syndrome, early identification of the symptoms helps prevent the chances of life-threatening complications towards the later stages. For this purpose, patient education about the possibilities surrounding this condition are very important so as to prevent the occurrence and worsening of the disease.